Hi, I'm Benjamin Hill with Mission Physical Therapy. As I'm working with my patients from day to day and teaching exercises, whether to stretch or to strengthen or whatever it may be, most people are trying to do things symmetrically. And in that, they think that, okay, if I've done 20 over here, I want to do 20 over here. If I do 5 over here, I do 5 over there. And the problem with that logic, I mean, it is logical, is that it doesn't fit the fact that our bodies are not symmetrical. If we were symmetrical, it wouldn't be a big deal. If we were symmetrical and a bodybuilder was working out and they did 5 or 6 sets of a dumbbell, of a butterfly on one side or curls on one side, you would think they would do the same on the other, and they would do the exact same number. Okay, I'm going to do 10 here, I'll do 10 there. I'll do 12 here, I'll do 12 there. And yet there's a reason, for aesthetics perhaps, but in bodybuilding that they judge based on symmetry. And it's partly because it's very hard to develop symmetrically, partly because we're not symmetrical. We're not born symmetrically, and we use our extremities differently, whether it's because of hand dominance, if you're right-handed versus left, and your brain has an easier time recruiting your muscles on one side versus another. And so in an effort to be more symmetrical with regards to strength training, you want to work your muscle to the same level of difficulty on one side as you do on the other. And so you might stop at 12 on your right arm and stop at 8 on your left. And similarly, when it comes to flexibility and you're trying to loosen things up, you'll find that you go to stretch your hamstring or your piriformis or some other muscle, and one side feels a little tighter than the other. Now, as a hint, do the strong side or the loose side when it comes to stretching first, and you'll find that there's a better carryover effect to the other side. Meaning, if you do the stronger side first in doing a curl, your brain has some way of carrying over the way you coordinate your muscles for that motion to the side that you didn't do as well on. And similarly, if you go to do some trunk rotations, for example, on one side, and you find going to the right is easier, loosen that up a lot, even more, and then try your problem side and see what happens. You'll find that you can develop an even better symmetry between sides. Just a few tips from us here at Mission Physical Therapy.